About 30 minutes. Hey guys, I am Haley Gray and I am the group owner in the Women's Entrepreneur Network. I am a digital marketing expert, and tonight we're going a totally different direction. We're going into the healthcare field, talking about functional neurology. And I have an amazing guest tonight. This is Dr. Angela Gabella. Welcome.
Oh, hi. Thank you for having me. I'm excited to be here.
This is fun. So if you guys are on the live, give us a hashtag live. If you're on the replay, give us a hashtag replay, and raise your hands if you've ever heard of a functional neurologist.
Mm-hmm.
Or actually, maybe raise your hands if you have never heard of a functional neurologist.
Mm-hmm.
So, Dr. Bella, tell me exactly what a functional neurologist is and what you do, because it's not like what I thought the first time I had heard of what you do.
Absolutely. So functional neurology is a branch of clinical neuroscience, and we differ mostly because we're looking at the way the brain is functioning. And so the brain is made up of a bunch of neurons. It's 100 billion plus neurons, and we actually have 10 to the 15th connections. So we are who we are today as humans, and we think the way we think, we feel the way we feel because of the way our connections within our neuronal networks. So those connections are super important. And those are also the connections that are damaged when people have neurological symptoms that are not structural damage. So when you have structural damage, it's easy to see, it's easy to diagnose. Your diagnostic imaging will show that as well. So like a tumor or a bleed, you actually see it. Now, if you have problems with the functional connectivity between neurons, you cannot see that on diagnostic imaging. It's not a structural damage. So your brain looks totally fine. However, the way it's firing, the way it's working, the way the neurons communicate is not fine. And that's where you have all of these symptoms. So it's a different approach, and you have to not only be able to say, okay, these are the physical exam findings, we can quantify them, but then you have to say, how can we activate the nervous system to fix it? And so that's really where functional neurology is extremely different, because we're here to treat the patient so that they actually have long-term recovery.
That's cool. Yeah. And I've seen some things that you work on with patients. And one of our Facebook viewers says, I happen to be suffering right now with a major nerve pain in my neck. Interesting.
Mm-hmm.
And it's kind of interesting to me because you treat a range of different things, because people come in with like all kinds of different weird symptoms that are all caused by the brain.
Yeah. Absolutely. So sometimes it's hard to kind of summarize, like, what do you treat? Well, I treat a lot of things, because there are many types of neurological symptoms. They can be physical pain. Chronic pain syndrome is actually a pain presentation that develops because the way the brain is processing pain changes. So if I stab myself with a knife, there's a reason why I have pain. But then if that knife is gone or the broken ankle is gone and I'm still having pain, it's the way the brain is adapted to it. So it can be something that is from a pain standpoint. It can be something from a cognitive standpoint, like if my memory is declining. That's a big, it could be a 20-year-old guy who had a concussion and he can't remember words when he's speaking, or he walks into a room and he can't remember what he went in there for, or it can be because of neurodegeneration. So symptoms can be caused by many different factors. But yeah, I treat so many. Dizziness is a big one. Any form of dysautonomia and getting circulation and blood to areas of the body, insomnia, anxiety, depression. So it's hard to kind of simplify that answer. And the patients are always different. And that's what's important, is that everything is very individualized. It's very patient specific, and exactly what their baseline brain function is, and then where their weaknesses are.
Cool. Yeah. Beth LKC says, hey, Haley and Angela just hop online and found you guys. So, my daughter just handed me things back. So anyway, it's really interesting to me because a lot of people who have concussions in particular,
yes.
Tell me a little bit about like concussion protocol and like where we've been and where we're going with concussion protocol, because I know that one of your particular strengths is definitely like dealing with those TBIs, those concussions, those problems that happen with that. And I mean, as a mom of kids who have had concussions, this is particularly important.
Yeah, it really is. And so I'm going to start with the term neuroplasticity to kind of explain the evolution of neurology, the evolution of understanding brain function itself. So in 1990, we were still thinking that the brain is static, that it doesn't. And when I say the public, the actual clinical application of medicine was still thinking that. Now, our research was saying a total different thing. And they were saying, no, the brain is not static. It's very plastic, meaning it changes. You provide a stimulus to it and you get new connections and the patient has new functions that recover. So finally, by 2000, the research translated over into clinical practice, and it was being talked about that you can activate the nervous system. People that were untreatable are now completely treatable with neurological symptoms. Now, concussion is it's a game changer for how we will always treat neurological disorders, because it was that one condition coming in and they're having they don't feel right. They're having memory decline, irritability, anxiety. I mean, you name it, they have it all. And they would get run through the whole vigorous batch of tests. They would have all blood work done, all these diagnostic imaging, and nothing's wrong. But yet the person can't go to school. They can't work anymore. So they're a great representation of when you activate their nervous system specific for what they need, then they recover. So you're literally showing that you can create brand new connections between these neurons to recover function back. And so that I think it's a great example. I like to use it. Concussions are very hard to treat because no one concussion is the same. They're vastly different. Concussion just basically means there's a trauma to the head, and they have physiological damage. So their functional connectivity is damaged.
Right. And one of the things that I've learned in dealing with my oldest with a traumatic brain injury is that even if you don't lose consciousness, you could still have really severe symptoms.
Mm-hmm. Yep, 1,000%. So, and that's the other thing, where all brains are very, very different, and we have different things going on. And with females, based on, there's some great research coming out with soccer players, because there's a lot of female soccer players. So based on their menstrual cycle, so if they're at that 2-week mark and they're starting into that luteinizing phase, and they have a head injury at that point, it's going to be significantly worse because of the circulating hormones they have in their bloodstream at the time. So when you have your concussion, and there's things with men too, but the timing of a concussion is significant. The mechanism of a concussion is significant. And you could have one person that was unconscious and they might come out with a very mild concussion, and somebody who was completely conscious the whole time, and they're terrible. I mean, they have so much stuff, and you understand that too.
Yeah, my oldest never lost consciousness with her traumatic brain injury, and it
was devastating.
Mm-hmm. We've had no end of complications from it.
Mm-hmm. Yeah.
So one of the things that you deal with a lot with people is tinnitus, the ringing in the ears and the dizziness and those kinds of things. So what causes those, and how can you treat them? Because a lot of people feel like they can't treat them, they can't deal with them. Most regular doctors are like, yeah, we try maybe a Webster technique and then you're done.
Yeah, absolutely. So tinnitus is like affecting way more people than we even realize, because some people will have tinnitus and it's mild and they can live with it. Others, it's absolutely awful. So the mechanism behind tinnitus, I'm going to kind of explain it to you in a little more detail so that you understand. You could tell somebody else who maybe has tinnitus that understands. But as I'm talking, you're hearing me and you're hearing the pitch of my voice and hearing that through your ear. And then it's going to go and it's going to synapse to specific neurons in your temporal lobe that correspond to the pitch of my voice. So then we hear sound, right? So if that temporal lobe becomes unhealthy, in the process of a neuron kind of dying off, it first begins to spontaneously fire. So it spontaneously fires, and then eventually it'll degenerate and die off, and then it kind of goes away. So then you won't hear a sound. But as it's spontaneously firing, you're going to hear a sound, a pitch. It could be ringing, it could be buzzing, it could be one ear, both ears, or some patients are like, no, it's definitely in my brain. I could tell it's in my brain. And so that pitch, and so the pitch of somebody's tinnitus will change throughout the progression, or just the time frame that they're having the tinnitus. And so what it is that those neurons are firing and creating a sound that is not coming from outside of my ears, but it's actually coming essentially from my brain. So a great way to treat tinnitus is to match the frequency of sound that they're hearing. Because what that means is if you're going to match it, and then basically the patient or the person will feel like they're no longer hearing sound because you've completely canceled it out, but you're giving those specific neurons that are unhealthy the activation that they need. So that's a really good stimulation. Now, the concerning part of tinnitus that people don't realize is our temporal lobe is not just an auditory lobe. It's also involved in our memory storage, our long-term memory storage. And that's really, really important because who we are as people is our memory. And if you've been impacted by anybody who has Alzheimer's disease or dementia and they begin to lose their memory, you realize that they lose their personality, they lose who they are as a person. And it's really sad for that to happen. So in terms of keeping the integrity of your temporal lobe up, you do want to treat tinnitus. And it's very unfortunate that so many providers are like, oh, it's untreatable, just deal with it. Tinnitus can also be caused by different mechanisms. So sometimes people who are around like super loud bass music, or they shoot a ton of guns, they can blow their eardrum and develop a tinnitus that potentially goes away. And so in that term, that's more caused from a peripheral ear injury, basically. And that's different than a tinnitus that you just have throughout time. Now, you could be at a gun range, blow your eardrum, have tinnitus, and then it doesn't go away. And in that scenario, it's now turned into an actual brain, a central issue versus just the peripheral ear issue. So yeah.
Fascinating stuff.
Yeah.
So what about people who have like dizziness and, like depth perception issues?
Yes. So that's actually very common too. And dizziness is a cool subject for me because I really respect the vestibular system. People think like your vestibular system is just your balance. It is not at all. So we have a vestibular system that's in our inner ear, and it's made up of what's called the semicircular canals. And then you also have something called the otoliths. So semicircular canals are rotational, and they have a time constant, meaning I rotate and then they turn off, they stop firing. But the otoliths are constantly on, and they are the big sensor of gravity. And so that system fires into the brain centrally, and it has tons and tons of pathways. Literally, it synapses on almost every pathway or every area of the brain. And the reason being is it has to constantly communicate to our autonomic nervous system, because as I'm sitting down, my heart rate and my blood pressure are at one rate right now, because my brain's telling my vestibular system, my otolith is telling my brain that I'm sitting down right now. But the second I get up, I'm now changing my position in gravity. And so if my vestibular system, my otoliths were not working well, they would fail to communicate to my autonomic nervous system and say, hey, she's getting up, she's translating up in gravity. We need to increase her blood pressure, we need to increase her heart rate, and then we need to bring it back down to a baseline. And this is happening with every single thing we do as human beings. And so it's a very, very powerful, powerful system, and it doesn't turn off. So it actually, sometimes people understand what the default network is because it's becoming more of a buzzword with people involved in like neurofeedback and things like that. But the default network is a network that feeds into our thalamus and things like that. But it's a network that keeps our brain alive, because our brain always has to have some form of stimulus. Mm-hmm. And so when we're sleeping at night and we're laying down, our eyes are closed, we're still, we're going into our circadian rhythm, sleep cycles. But the one stimulus that is always on is gravity. And so it literally feeds right into that default network and helps do this baseline, very low frequency activation of all our brain cells. And some pretty cool research coming out around that is research with astronauts, because since we sent the first person to the moon, there's major consequences of these astronauts being out of gravity. So they have to do tons and tons of rehabilitation. They've created different devices up there to create an artificial sense of gravity so that they don't get all crazy. And they'll literally get mentally crazy because they don't have gravity.
Interesting.
Yeah.
Yeah, I was going to ask you, how does this affect astronauts? Like if our bodies are constantly sensing gravity and you take them into a 0G situation and leave them there for a year.
Yeah, there's been major incidents of just like psychogenic things where like they start hallucinating. So it's not just a balance. It's not just it doesn't just connect to your cognitive system in the way we think, but it's also our emotional stability. Yeah, it's pretty awesome.
Interesting. So the lack of gravity can like mess with every single.
It really does. And I love it too. That's the other side note, because it's has so many connections in the brain. You can really use it to activate those systems to remap the connections that are weak in somebody's nervous system.
Fascinating. And then, so how do you fix that?
So you fix it from many aspects, but with any patient, I'm always approaching it. What is with their nervous system? There's generally going to be a lot going on, and a lot that's not healthy, and then a lot that is healthy. And the nature of it is we live in a world where people forget that our brains are on all the time. And so things we eat, medications, toxins are around, anything that gets in the blood system is in our body has the potential to affect our brain. And so we're in a electronic environment. We're always using devices. We're go, go, go. And our brains are much less healthy today than it was 50 years ago. And it's going to continue along that pattern too. So sometimes people don't even have a history of like a head injury. They don't even know what caused their symptoms. But so in terms of how do you treat it, you always have to go to the first essential system that's damaged. So there's always a priority with the patient. Like if somebody comes in and their autonomic nervous system is not doing well, I'm absolutely going to fix their autonomic nervous system first, because that's a system that controls blood to every brain cell and blood to every body part, as well as our vital functions into our organs. So you can't let's say they come in and they're not complaining of autonomic symptoms, but they're complaining of depression, or they're complaining of cognitive symptoms or balance issues. You don't touch those areas of the brain until their autonomic nervous system is stable. And then you begin to work at the next system. So in the case of their autonomic system, if there was a vestibular component, then you fix that. And you basically work your way up until you get to the cortical levels, because when you talk about like phylogenetically and how the brain evolves, all of our primitive stuff, so lower in the brain is vital functions, right? And then the larger, longer, wider connections are a big priority too. And then the cortex is like a last priority, meaning that it's developed later on with the way our brain develops. So yeah, that's kind of like the approach. And in terms of treatments, there's so many different treatment modalities. It could be an SSEP, electrical stimulation to cranial nerves. It could be very specific eye movement exercises. It could be passive vestibular stuff. It could be translational aspects. You had mentioned depth perception. So depth perception is a big thing connected to our otolith system, the same system that senses gravity. Because if I'm translating in laterally, and I'm walking closer to an object, my eyes tend to converge together, to come in. As I diverge, my eyes diverge, I'm now translating posteriorly because I'm moving further away. And so that is all, my eye signals get that information based on what my vestibular system, the otoliths, tell it. So that's a big thing. So you start with the stuff that is essential, and then you work your way higher up. And there's some fun things about treatment. And then there's maybe some more boring stuff if you have to watch eye exercises and things like that. But there's always a lot going on.
That's cool.
Yeah.
So what are a couple of things in common that most of your patients have?
Symptom-wise
or experience-wise?
Okay, experience is a big one too. So unfortunately, the patients I see, they naturally, because of our health system and kind of where we at, and we're honestly in the early stages of really accepting that neurological rehabilitation is possible. So patients have always seen so many providers before they find me. It's not like they just find me and I'm the first person they come see. So it's always a journey, and there's always a lot of suffering, unfortunately. So one thing that I relate to, and I do my best to relate to them, that they're not alone, because I never really see a patient that hasn't been to so many providers that said, oh, go see a psychiatrist, or, oh, there's nothing wrong with you. And these are the people crying out for help because they can't even work. They can't hold a job anymore. They can't go to school. And so it's really quite devastating, and it's common across the board. So the biggest thing is not to give up hope, and to always remember, it doesn't matter what specialty they're in, no provider is created equal, and your doctor isn't always right. Whether it's a prescription drug that they want to put you on, whether it's some alternative treatment that you think is wacky that they want to do for you, it's really important for the patient to do your research and not accept what your doctor is saying as the hardcore or like cold cut. That's the fact. This is the case, because time and time again, it's not the case. And it's sort of like, as providers, as doctors, when you're good at one thing, when you're used to doing one thing, that's all they care about. And they kind of stay in their lane. And same thing, like, and I'm pretty good. If you're not in my lane of the stuff that I'm good at, like, I don't do a whole bunch of supplements and stuff. I'm really good at what I do. So I stick with what I do. And so it's the same thing. And certain specialties, they do what they do. And if you don't fit into that mold, you could potentially be told that nobody can help you, or there's nothing wrong with you. And so it's important not to give up and to fight, to advocate for yourself, to keep searching for a provider that can help you.
Yeah. And as a mom of kids who've been told, hey, there's nothing we can do to help you.
Yeah.
That gets really discouraging.
It is. It absolutely is.
Or, hey, it's all in your head.
Yeah, that's a big one. It's a big one. It's especially with dysautonomias and different POTS and stuff. And it's crazy because it's so easy to put somebody on a tilt table and measure the change between their blood pressure from sitting to lying down to standing. And our textbooks have said, there's an exact number to be looking at. If it changes this much, then that's POTS, right? And so those type of tests take time, and they don't get done. And there's a lot of patients that kind of get told, like, it's all in you're dizzy, it'll go away. It's all in your head.
Is that how they're leaning over? Yeah.
Yeah. Yeah.
If you can't do it, well, maybe you should just use a grab stick.
Yep. Yep.
I've gotten that. Yeah.
It's terrible. It's terrible. For sure.
So cool. So how would somebody go about finding you?
So really, most of the time, because functional neurology is not a known term, so a lot of times I believe patients are finding me because they're Googling their symptoms or they're putting out there. But the best way to summarize what I do is neurological rehabilitation. And I'm sure that some people that don't live in Raleigh area will have issues. And you can go to the Carrick Institute, and there's a lot of functional neurologists. The doctors that I recommend are the ones that have also done the fellowship with me. So Dr. Carrick offered one fellowship. It started back in 2013, I believe. And he taught, it was 13 to 16, 25-hour lectures on traumatic brain injury and rehabilitation. So the fellowship is called Brain Injury and Rehabilitation of the American Board. So those providers had a lot of hours with Dr. Carrick. So Dr. Frederick Carrick is the founder of the field. So they're not just learning from a textbook. They're not just learning from another doctor and another doctor that at one point learned from Dr. Carrick. They learned directly from Dr. Carrick. So, and I know a lot of them, and they're fantastic. They're very brilliant at what they did. And they were at grand rounds with Dr. Carrick. So Dr. Carrick saw every few months in a 2-week period, we would see thousands of patients from all around the world. So very tough, complicated cases. And so these fellows were all there seeing it front hand. So if you go to the Carrick Institute, and there should be a search on there. Let me see if I can actually very quickly. There is there's our board for the fellowship.
The Clinical Neuroscience Program. CarrickInstitute.com.
Yes, CarrickInstitute.com. But then there's the American Board of Functional Neurology, I believe, is the certifying board. Yeah, it's acfn.org. Yes, perfect. So Doctor Locator. So the website is acfn.org. And then there's a doctor locator at the top right corner. And so you can search for doctors in your area. Those are going to be the top of the top. Like, let's say there isn't, because I don't know how many there are or how many are on the website, but let's say they're not in your area. Then you can go to the Carrick Institute and there should be a doctor locator there as well. Or you can contact Haley and I will find somebody closest to you that I will recommend.
That's cool. Yeah, that's pretty awesome. You know, it's one of those things that, as we've gone through our journey with my oldest and, you know, kids with concussions and all the things the last 5 years in our family, you know, I've learned to really appreciate different modalities and different types of practitioners and a lot of these more holistic approaches, because sometimes they're like unbelievably effective.
Oh, absolutely. And that's the whole thing too. Sometimes there's certain, like I'll use acupuncture, for example. So some patients acupuncture does work. Others, it's incredible. It's life-saving, you know? So sometimes even if you're skeptical, it's worth a try. And it's always helpful to look at the provider's education. Sometimes it's easy for providers to say they have some sort of certification in this and and fancy equipment stuff. And it doesn't really equate to their ability to serve their patients. So, you know, I understand it's tough because, you know, providers want to feel like they're doing a justice and they're getting more patients. But yeah, it's always worth a try and call and ask questions and things like that. But if I can help in any way in terms of recommending, I certainly will.
That's awesome. Cool. Thank you so much for joining me tonight. This has been fun.
It has been fun. It's been wonderful.
Yeah, she's like, what have I gotten you into?
I know. So when I first got on with Haley, I was literally in my pajamas. I always thought we were doing like a podcast thing. I had no idea I'd be on camera. So, yep. Sorry, guys, but
I'm a bad influence.
It's still a pleasure.
Thank you so much. This is awesome.
Haley, yes.
Thanks, guys. And I posted Dr. Gabella's links in the comments and in the links. So make sure you check her out.
I saw somebody say Raleigh, North Carolina. Darn. So if that is a person, you guys have contacts with Haley. So if anybody needs a recommendation for their area, please reach out to Haley. I will certainly respond quick with those. Okay. Bye.
Awesome.
Thank you.
That's awesome.
Right. Bye.
And you got a great big old thank you. So cool. Take care, guys.
Bye.
Night.